Hello and welcome to 20 Minute Health Talk. I'm Sandra Lindsay. Today, I have the pleasure of speaking to a woman I admire, Dr. Stacy Rosen. She is the Senior Vice President of Katz Institute of Women's Health at Northwell Health. Also, Partners Council Professor of Women's Health at Zucker School of Medicine. Dr. Rosen, thanks for being here.
Oh, it's my pleasure. Thank you for having me.
So, as a Black woman, I'm concerned about all aspects of my health, especially heart health. The statistics around Black women's heart health is just startling. Black women are disproportionately affected by cardiovascular disease. Why is that?
It's a very good question. And we are actually, unfortunately, over the last few years, getting worse rather than improving. So you go back decades, maybe a century, and all of our healthcare model was focused on men. And in cardiac disease, that was the most notable area where only studying men, particularly white men actually, of a certain age and body size, led us to believe, erroneously of course, that women didn't get heart disease. So for decades, we studied men. We minimized symptoms in women. We didn't appreciate differences. For almost 20 years, death rates for women went up and death rates for men plummeted. And it became the classic example of why sex and gender matters. When we started studying women, specifically, we realized that they're different than men. Then we looked sociologically that women have a tendency to put themselves last on their to-do list or not even making it on their to-do list. And so a disease that is 80% preventable, we lost the opportunity. Then when we started looking at Black women versus non-Hispanic whites, Asian Americans, we started to see even more of discrepancies. And again, the answer is multifactorial, Sandra. It is increased prevalence of many risk factors, hypertension, inactivity. In the Latinx population, increased prevalence of diabetes, obesity in Black women. Then you put on top of that societal issues relating to accessing care. And finally, you put in that mom always or women always taking care of everyone else first. And it becomes this tsunami of additive problems.
So among Black women ages 20 and older, nearly 59% have cardiovascular disease. You mentioned some risk factors before, but I think it's worth stating again that may be driving this startling statistics.
There are the traditional risk factors for heart disease that we talk about, and unfortunately, most of them are far more prevalent in Black women. So if you look at women over 20, 40% of non-Hispanic white women will have high blood pressure, but almost 60% of Black women will have high blood pressure. When we look at diabetes, when we look at inactivity, when we look at overweight or obese, all traditional cardiovascular risk factors for heart disease and stroke, the prevalence of Black women in the U.S. who have these far exceeds white women. And for something like diabetes, the Latino population is worse than both, non-Hispanic whites and Blacks. And again, that is something that we can't, sort of shrug our shoulders up and just acknowledge. We need to study. We need to do basic science. We need to do clinical work. And we need to do implementation science. Why, if we know that we can treat hypertension, are 2/3 of Black women not controlled? There's something there that we have to fund, ask the questions, and make the science better.
Absolutely. So there may be a gene that makes Black population much more sensitive to the effects of salt, which in turn increases the risk for developing high blood pressure. As little as 1 extra gram, that's a half a teaspoon of salt, could raise your blood pressure by as much as 5 millimeters of mercury, according to American Heart Association.
Absolutely. And that is the classic fact that makes it important to study populations and report the data independently. So that fact goes along with the data that shows that there are certain antihypertensive medications that are more effective in Black individuals than whites. For just that reason, that there is something different at the cellular level, the genetic level, and we need to study that.
The risk factors that you mentioned, A lot of it seemed to stem from socioeconomic status, perhaps where you live, your culture, the risk factors that you mentioned that are 80% preventable: obesity, diabetes, hypertension. So how do we begin to tackle those?
No, absolutely. And we first start by studying it, honestly, because we know that socioeconomic issues and social determinants of health, as we define these, have a huge impact. In fact, the NIH and the American Heart Association have put out very firm commitments to focusing on this sort of research and not throwing our hands up. It's too hard. Food insecurity, education, access to care, even language barriers. We can't say there's nothing we can do. But we also need to study genetics. In the field of hypertension, there has been some interesting work done on understanding, are there really differences in hypertension based on where you're from, what your background, race, and ethnicity is. So I think there's so much fascinating opportunities for us to study this more and not just put our hands up and say, this is too hard.
So I agree with you, but you and I know when it comes to anything that says research, how especially Black people of color are so afraid.
With good reason.
With good reason, not trusting. Then you throw on top of that access to research and, how people know about these research opportunities. How do we navigate that?
No, absolutely. And I'll tell you that we add on to that having researchers who look like the patients. Right?
Exactly.
So I think the first step is acknowledging that it's a problem. And I think that the funding sources, certainly the federal government, most of the important foundations have acknowledged that this is a problem. And number two, you identify ways to get past those barriers. And it's hard, but it's valuable. So it includes appreciating how do we mitigate some of the expected lack of trust that exists? How do we tell Black women that in order to come for the trial, you need to come to someone's office 3 times a week when they're taking care of a job and family? So we need to look at what the barriers are and really realize that that hard work is worth doing.
Yeah, so speaking about something that needs to change is for us to prioritize ourselves.
Absolutely.
Some me time, if you will. For example, I meditate.
Wonderful.
Love transcendental meditation. But sometimes I fall off and then, I just feel like my head is cluttered. There's no clarity. And I have to then say, Sandra, you got to stop. You got to make time. You got to make time. So are there any strategies for women?
Yeah, no, that is a great. I've actually just taken up meditation. It's fabulous.
It is.
And I like to do 10 minutes a day. And then 10 minutes doesn't seem like a lot, but our days are crazy. I think for two suggestions I have. Number one, you really have to acknowledge that every little bit counts. Women are also perfectionists by nature. Mm-hmm. If I don't do it perfectly, I'm not doing it at all. If I eat one cookie, I'm going to eat the whole box. But the truth is, 1 minute of meditation matters. So you're sitting at a red light and maybe there's a breathing exercise that you can do. So that's number one is, be proud of everything you do, even if it's a 5 minutes or a 2 minutes walk up the steps, and secondly, figure out a way to not fall off the wagon. I have patients who've been successful competing with friends. A long-term patient of mine the other day said that she's been walking with a girlfriend every day for 12 years. She hates every minute of it, but they do it because they know it's right for them, and the friends keep each other. So the partnerships keep us on the right path, and also cut yourself some slack. There's days you just can or don't or won't. Fine, tomorrow's another day.
Absolutely. Also, I would say that refrigerator where you have the big calendar with everybody's schedule, make sure you put yourself on that calendar.
Absolutely. And put it on top. Some of my colleagues at the Center for Wellness and Integrative Medicine have a lovely slide that says the grass is greener where you water it. Meaning if you don't take care of yourself, you can't take care of others.
Right. And you can no longer be the CEO of the family,
Exactly.
a position that, women are
We're born
proud
to.
to have, right?
Exactly.
You're proud to have that title. So you have to protect that title.
Of course.
So, let's talk about knowledge deficit, because for many Black women, particularly those who consider themselves perfectly healthy, their perception may not always equal reality.
Absolutely. And so since I think it's 2009, there's been a publication put out every couple of years questioning women as to their understanding of what their biggest risk for death and disability is. And we started with only about 50% of all comers knowing that heart disease. When you look at Blacks and Hispanic women, the number's even lower. And so there were campaigns. The media has been great, newspapers, women's magazines. But for the first time a few years ago, the numbers are dropping. So we're actually going in the wrong direction. And it's now fewer than 50%. And when we look at Black women, fewer than 40% know that their number one risk is heart disease. So you think, if I don't have symptoms, if nobody in my family, maybe I am slender, there's nothing you can do, you're not going to get heart disease. And that's a problem. 90% of women have a risk factor, and it's never too early to start understanding them and impacting on them.
Right, because only 39% of Black women are aware that chest pain can be a sign of heart attack.
Is that amazing? That is something that is horrible to hear. And what's interesting, in the past, when we had these crazy statistics, again, instead of throwing up our hands, we thought, well, how do we get to women? And an interesting questionnaire went out, and 45% of women at that time, a few years back, got their health information from magazines and the media. So here we were focusing on community groups, doctors, clinicians, hospital newsletters. But no, we needed the media. We needed Women's Day and Essence Magazine and the newspapers to be trustworthy sources then. So again, that fact should bring urgent bells, fire alarms, and that we need to do better.
So where should women be getting their information?
Yeah, that's a great question. I think it starts by, to the best of our ability, finding a clinician who becomes your partner. Nurse practitioner, obstetrician, internist, cardiologist, somebody who you trust, who trusts you. Secondly, make yourself a better patient advocate for yourself. We would never go to do our taxes without